And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, hello and welcome to Boomer Life here on CIL 650. Starting things off musically to the, little Kylie Minogue goes a long way with this group of guests, I'll tell you. We're going to talk to the people from Neurokinetics. Back with us on CIL 650. Dr. Philippe Silvestre, J.C. Gordon, and Sonia Dale are back in studio with us. And Sonia really likes that Kylie Minogue stuff.
I do.
Welcome back. Nice to see you all.
Thank you. Nice to be here again.
Philippe, good to see you too.
Happy to be here.
And J.C., good to have you back on side with us again today.
Always a pleasure.
Tell us about Neurokinetics. You're the Director of Liaison and Logistics at Neurokinetics. You're the one of the more recent members to the team. Tell us about the organization and what drew you to them.
Well, Neurokinetics is all about optimizing the brain. What Dr. Silvestre has been able to find over the years is that when problems persist, there's an underlying cause, and that underlying cause has been the fact that the brain hasn't been able to be optimized.
Okay.
And so what Neurokinetics does is measures the dysfunction and reverses it and changes it so that it becomes functional.
Okay, so this whole phrase, brain optimization, keeps coming up in our conversations. It's coming. What exactly, Dr. Philippe, does brain optimization mean?
Well, several things. Usually it is a sequence of actions in restoring functionality in a brain which has been disabled.
Okay.
The first thing is to ensure there is no damage that could prevent permanently the recovery.
So
of
an assessment is first and foremost.
An assessment is primordial.
Okay. So brain optimization then means being what JC was just talking about then, finding out where the deficiency occurs and restoring the brain to its original functional capabilities.
Or sometimes even better than it was before trauma.
Interesting stuff. Sonia Dale, nice to have you back with us.
Thank you.
I'm glad
Pleasure to be here.
I'm glad you appreciate the music. Yeah, Sonia is the clinic manager and very frequently the first person that you'll call when you check into Neurokinetics. So given that you speak to or respond to emails from people who approach Neurokinetics for the first time, tell us a little bit about Neurokinetics and what you do and why so many people seek you out.
Short answer would be it's a last resort for many people out there. That being said, is they've tried many other things, many other doctors, many other specialists, and then lo and behold, they do come to us, being that they're at their wits' end. Mm-hmm. So usually is when they do come to us, either they've done their research online on Google or any other website kind of a thing through us and checked and seen what is Neurokinetics all about? What are they able to do for us? Majority of our patients are also referred into us from former patients, existing patients. They come in to see us mainly because they want to know what we can do for them.
Right.
They give me a call. What can you do for us? We're there to listen to them. Consultation is set up with them. Step by step, everything is dealt with at that point within the half hour, 45 minutes, listening to what their condition is.
Right.
Excuse me, what their symptoms are, and everything's discussed at that point with them openly.
Okay, now, JC, Sonia says that in many cases, Neurokinetics is a destination of last resort, which suggests that in many cases, patients who see you now have been around the circuit, so to speak, and have had to try to describe their symptoms to other professionals with limited success.
That is absolutely so true, Sterling. I have had so many conversations with people who have called us as a last resort with very little hope.
Right.
Simply because of the fact that everything else that they have done, everything else that they have tried hasn't worked. And many times these people have been put in the management stage of the medical cycle, which is medicating them to death simply because they haven't been able to get an answer as to how to overcome their problems.
So they've gone to a doctor and described at length perhaps a traumatic event, an accident or something that caused them to be in pain. And here's the nature of my pain. And the doctor attending at the moment says, well, I've got something for that, writes them a prescription. This should manage your symptoms and sends them off. And that's the end of it. That's about as far as that particular professional wants to go.
Well, and that is where we get the phone calls from people at that stage. I just recently had a phone call from a lady who was a teacher, and she had a car accident, and she had a concussion. She was suffering from post-traumatic concussion symptoms now for 2 years, and she had a young family. She had a husband who was working and hadn't been able to get any help whatsoever with her symptoms. And she had been told, this is how you're going to have to be the rest of your life. And I had a call with her, and a lot of times when I speak with people, it gets emotional.
I'm
because
sure it does.
For the first time they're hearing that, hey, I might be able to be helped here.
Right. Yes.
And as Sonia was saying, we are a clinic of last resort. We are a destination clinic because we get so many referrals from people all over the world.
Sure.
Either from former patients or Philippe's connections with NASA. We get a lot of referrals through the Space Organization as well, simply because of the brain optimization that Dr. Philippe has been able to pioneer. And the results are just phenomenal.
Well, I'm glad you opened that door, because Philippe is far too modest and would never do this himself. So now, thank you for doing that. Our other guest from Neurokinetics is Dr. Philippe Souvestre, who in September, in just over a month or so, will go to Oxford University in England and be appointed a member of the International Academy of Aerospace Medicine. Congratulations to you, Philippe. That's an extremely prestigious appointment.
Yes, it is.
So talk to us a little bit about these people who come to your clinic, who come to Neurokinetics, who have been told, as JC just described, well, it's unfortunate that you had that event in your life that caused you damage and trauma, but unfortunately, it's most likely that you're just going to have to live with the consequences of that event for the rest of your earthly days. That's about all we can do for you. So just adjust yourself accordingly. Have a nice day. And that's it. People get told, well, I'm afraid that, well, that's all we can do for you. And they almost smile when they say that. And you know that that's just not true. And that's why people end up at Neurokinetics, in many cases, as JC has said, pretty emotional and more than a little frustrated.
Yes, indeed.
So talk to us about what you do with these people when they come to you. Literally, as both Sonia and JC have said, literally at their wits' end. They're just beyond frustrated. And mostly, in many cases, too many drugs that aren't particularly helpful, and too few sympathetic ears to listen to their story. Clearly, that's remedy number one for you. Take the time to listen. And after that, what do you do?
Well, once we have listened to them, there is a bond who appears and trust rises. Most of patients live in fear after having seen hosts and hordes of practitioners who were supposed to help them and came up with everything but help.
Right. Well, that would make a person afraid after a while. Maybe, JC, if somebody says to me, well, gosh, that's too bad, Sterling, that you had that event, but, you're just going to have to suck it up and live with it for the rest of your life. That's going to make me a little nervous about the quality of the rest of my life and about how vulnerable I might be to other incidents coming up. So there's no reassurance there at all, is there?
There really isn't. And as I mentioned, Sterling, a lot of times people talk to us initially, and they're very, very skeptical as to what we can do.
Right.
That why is it that you guys can do it and I haven't been told this before, type thing.
Right.
And that's why we are a private clinic, quite frankly, because when we work with our patients, it's not like a patient is going into a normal clinical medical setting where they only have 5 minutes or 6 or 8 minutes with a particular practitioner. We spend hours at a time with our patients to go over their history, to determine if we are going to be able to help them. And then when it does come to treatments, Dr. Philippe is spending up to 2 hours at a time with each patient to move them through their needs.
And I suppose, Sonia, that frustration that JC was just talking about, you hear it first.
I do.
And a lot, and the skepticism as well. Listen, you know, I've called more than a few clinics in my time, and I haven't been very satisfied, and I'm tired of getting the runaround in that, and I'm expecting more of it from you. And you surprise them because you don't give them the runaround.
No, we don't. And they do have a valid reason. I mean, if you've been around the block, as you want to call it, they've been to many different doctors, many different specialists, and you've only heard one, you know, one statement is the fact that it'll go away in time. You're pretty much dealing with it for the rest of your life. Or you got to take these meds for the rest of your life or for X number of years. And you finally come to a clinic or a resort, as you want to call it, and they're saying that there is hope. I do understand their reasoning, and I do understand the emotions behind it. But we explain to them the process. We explain to them the time that Dr. Philippe puts in, our team puts in, and things can change. I mean, those symptoms can go away. The condition can eventually, in the amount of time that we're going to work with them, will eventually go away. Yeah.
Dr. Philippe, JC mentioned the word concussion a few minutes ago, and we hear that word all the time. And yet, concussion is another fancy word for brain injury, is it not?
It is a modality. It is a modality of brain trauma.
Yes.
Brain injury implies we have a damage that has occurred anatomically. So I stay away from injury. I prefer the word trauma, which is more neutral and more encompassing of either without damage or with damage.
I'm trying to figure out, or trying to ascertain what sort of person would be an ideal candidate for neurokinetics. And we're going to talk a little bit on the program today about accidents and injuries, whether it occur at home, falling down the stairs, or a workplace injury, and some of those can be pretty severe, or sports or whatever. Do people who come to neurokinetics, Philippe, have they been typically injured and they're still trying to recover from a fairly traumatic injury?
Yes, and that would be the common denominator of all our patients, whether from an acute situation, recent accident, or long time ago occurrences. Incapacitation is the master word. Incapacitation reflects the lack of performance that has built up, that has occurred, that has grown after a given event or particular event.
So by incapacitation, for example, if someone is injured in the workplace, for example, and is incapable of going to work, that's incapacitation. The person can no longer earn a living. But beyond that, there's a psychological incapacitation, because once you're out of the workplace, you're no longer, you lose a certain credibility in society. There's a social thing that goes on here too.
We call that disconnect.
Okay.
It's a disconnect with everything that is fostering in us the best side of things, including aspirations, ideal, vision, feeling on a mission, feeling able or being enabled by whatever support system available to perform what we are meant or feel called to perform.
Right.
So fear takes place in that case after a little while. It doesn't take long to feel that increasing uncertainty, and everything becomes out of reach gradually.
And then that fear can very quickly morph into anxiety and other more serious conditions, can't it?
Panic attacks.
Yes.
Yeah.
Sterling, there are levels of incapacitation. Just like going up the stairs, you go up one step at a time. We just had a gentleman come to see us, a young gentleman who was riding a bike, and a car turned right in front of him, and he ran into the car
and went flying over the handlebars.
Flying over, and he came in to see us about 10 days after that. He was not totally incapacitated, but he knew that he was incapacitated simply because he wasn't as sharp as he was. He's an engineer.
Okay.
He wasn't as sharp as he used to be before the accident at his work, on a computer, in talking, in speech, in memory, in that. So there are different levels of incapacitation, and it's literally like climbing the stairs.
And this fellow was smart enough to see that early on that he had lost his edge.
Exactly.
And that's for a professional. I mean, it doesn't take much to recognize that, but at least after recognize it, he picked up the phone and got busy, didn't he?
Absolutely, and that was more of a shorter term fix for us. But there are different levels of incapacitation, and if they're not dealt with at the earlier stages, they are going to say, as you say, morph into step 2, step 3, step 4, etc.
Which has to be explained in terms of complexity.
Right, right. So, and in many cases, as Sonia has already pointed out, Philippe, clients, patients come to you, and they've seen a lot. They've been exposed to a lot of different medical opinions and possibly even different therapies, none of which have worked because there they are at your clinic. So you recognize that these people have seen quite a number of medical people already. So are they skeptical when they see you, or are they just so tired of being sick and tired they're ready for anything?
You see both. Those you just described both ends of the spectrum.
Okay.
That's right. That's right.
Okay, we'll take a quick break here. When we come back, as part of our program today, we are very fortunate to have not one, but 2 patients from Neurokinetics who are going to jump in on the program, talk a little bit about their experience with Dr. Philippe and the team at, by the way, Neurokinetics, I should tell you where they are in Vancouver. They're in the Highcroft Medical Building right there on Granville and 16th at 3195 Granville Street. They're online at neurokinetics.com, and we'll talk to some patients and more with our guests when we continue on Boomer Life on Sea Isle.
Celebrating the baby boomer lifestyle. This is Boomer Life on Sea Isle 650.